Good evening, everyone. Thanks for joining us this evening for another one of our webinars. This is Dr. John Santa Anna.
Dr. Tom Nabity.
Dr. Rob Farhan.
So thank you for joining us. Tonight we're going to talk about how to optimize your procedures for these regenerative procedures. Regenerative medicine is a treatment plan that we do here in the office. It's a nice option that we have for a lot of our patients. But the question always arises, how do I make this procedure effective and for it to work for me and to increase my odds of getting a good outcome? The nice thing with regenerative procedures is that when we do your evaluation, we can tell you a pretty good idea of kind of how your procedures are going to go based on all the experience that we've had and our registry that we've seen. So every time we go look at procedures, the whole basis of regenerative medicine is based on tissue remodeling and tissue healing. So there's the phases that we have is the inflammatory phase, then you have your proliferation phase, and then you have your remodeling phase. And everything that we're going to be talking about tonight is going to be based on how to optimize those phases.
So there's the recovering from your procedure, from getting the best outcome from your procedure starts before your procedure. So there's things you can do to get your body ready. And it's pretty basic things that you can consider: eating well. And that means different things to everybody. But for my advice to patients, it's eating clean, trying to avoid the overly processed foods, trying to avoid high index sugar foods, eating more whole food diets, higher in protein, getting your body's weight in grams of protein are good, just general rules to follow it to prep your body to regenerate tissue. You can supplement your diet with things like oral medications, oral supplements. We have a regimen we recommend that involves a good healthy multivitamin, improving your body's stem cells through these supplements called senolytics. And then in our goal to make collagen, it makes sense to put more collagen into your body. And if we're working on making cartilage, it makes sense to use glucosamine chondroitin, which are building blocks for cartilage as well. Sleep's an important factor, making sure you're getting good, adequate sleep, prepping your body. That's when your body tends to regenerate, tends to heal its tissues. So sleep is an important factor as well.
So one of the things we always talk about is controlling the inflammation. So one of the things we actually want to avoid prior to is, if we can, avoid anti-inflammatory medications, because as Dr. Santa Anna mentioned, the first stage of healing is inflammation. So when we do these regenerative procedures, we actually want the body to inflame. So we recommend typically to avoid anti-inflammatories a week before if possible, but definitely afterwards for the next couple of weeks to avoid any anti-inflammatories. That not only includes over-the-counter medications, but prescription medications such as the ibuprofen brands, naproxen, naproxen. Another big piece of it is steroids. So a lot of times when people are in a lot of pain, the first response to other providers is to give you a steroid shot or oral steroid. So we definitely don't want those involved prior to these procedures, because that will definitely affect the outcomes we're hoping for. And the steroids especially, those take a while for your body to process. So if those are given for any reason, we definitely want to hold off on doing your procedure for a period of time before we actually do your regenerative procedure. And afterwards, definitely want to hold off on the medications for a couple weeks. And we have some strategies to utilize for post-procedure discomfort. Instead of using anti-inflammatories, we do have alternative medications to consider.
Yeah, so the whole premise of kind of what we do and the outcomes are primarily is based on how severe is the structure we're trying to treat, right? So that's something, unfortunately, we can't do much about. That's already what you have. One of the things that we look at is also your overall health. So that's still something that we can do with what we've been talking about with proper nutrition and kind of trying to optimize it. One of the things that we can do with that is with HRT, or hormone replacement therapy. So as we do get older, our body's hormones tend to decrease and not be optimized, especially for males. You get a decrease in your testosterone. For females, you have a decrease in your estrogen and progesterone, and some testosterone too. So we found that patients who are on HRT and being optimized that way do tend to be healthier and have typically a better outcome with these procedures as well. So just kind of looking at that from that point of view. Now, does that mean it's necessary to be on HRT to have a successful treatment? No, not necessarily, but it can definitely help. It's not going to hurt you.
I think that's a key point. It's definitely it's a positive addition to a regenerative procedure, but it's not a necessary requirement in order to get benefit from a regenerative procedure. And then what I classify as modalities, energies, different sorts of ways to stimulate your body's cells to activate and heal. We have a handful of them here in the office, but by no means do we have an exhaustive list. One of the ones we've had separate webinars on are electromagnetic transduction therapy, EMTT, which uses electromagnetic energy to stimulate cell activation. Another one is our shockwave therapy, and there's a lot of different shockwave therapies out. We have a focal shockwave, which is the best of the devices that are available, but it's not to say that other shockwave devices aren't in any way beneficial. So using those sound waves or electromagnetic energies to stimulate tissue healing and tissue growth can also help you recover from your regenerative procedure and get the most from your procedure as well.
The thing we're trying to improve is the blood flow. So we know, based on basic science, we're trying to get good, healthy blood flow to the area we're treating, not only to bring in healthy tissue, but also get rid of these old degradative old tissues that may not be helping you at all with chronic inflammation. So that's the idea of the modalities, not only the shockwave, but EMTT. And another option we have is red light therapy. Is another treatment we try to utilize, again, to stimulate the body's normal healing mechanisms in a focal area.
Another one we don't have here in our office, but there are local companies that do, is a hyperbaric oxygen, or another way, blood flow, getting oxygen, getting reparative tissues to the cells in need, is something called ozone therapy, where you can take the blood out and hyperoxygenate it and infuse it back in. Both of those can help with tissue healing and regeneration as well. And then peptides.
Yep.
So the big topic and kind of a hot topic in medicine right now are these medications that are classified as peptides. And most everyone's familiar with hormones, naturally occurring substances in our bodies. Peptides are very similar in their molecular structure to hormones, and they too are naturally occurring and have a purpose. They're classified as peptides rather than hormones because of the technicality on how long their amino acid sequences are, with them being shorter than those that are classified as hormones. But I think it's an important fact to know that they are naturally occurring. They're things that our bodies naturally produce for specific purposes, and when we can utilize that knowledge of what those signals are meant to do, we can trigger the body to improve itself from just the natural release of these peptides that your body makes on its own. We can augment that by using injectable medications, peptides. To name a few, I don't know if we each want to maybe take one or name some that you've used and had good luck with.
A common one is something called BPC 157. It's a very common one that you would hear with patients who are into sports. It's a good way of kind of augment injuries and kind of heal faster. Really easy to use. It's a daily injection that you would do intramuscularly. Very well tolerated. Very low side effect profile. So that's kind of one we use often. Yeah, in the office. The growth hormone analogs.
Yeah, growth hormone releasing peptides, GHRPs. There is an area of our brain called the hypothalamus that tells our pituitary gland to make more growth hormone. So by increasing the growth hormone releasing peptides, you can naturally stimulate your own pituitary gland to kick out more growth hormone. There's a various different ones out there: ipamorelin, tesamorelin, smorelin. They all have different efficacy in patients, pros and cons. Some have more appetite increase than others. So just depending on the individual patient, we can make recommendations on which ones might be best for you.
Yeah, so it's one of these things, again, like we can add on for patients. I think it's one of those nice things that you can do on top of it, again, but it's not necessary. But yeah, positive-wise, there's a lot of positive benefits to doing it.
And everything we're talking about, again, what Dr. Sanahan is saying is we're not totally sure how much these other things play a role in healing. We just know they do heal. It might be 1% or 5%, but when you add all these things together, it just gives us a better outcome in the long run.
Yeah, we get a lot of questions on what else can I do? What more can I do? It's not to say that's a replacement of the PRP or replacement of the stem cell. That's still the majority of the healing is going to come from your regenerative procedure. But just these are additional ways that we can just maybe get you, like Dr. Farhat was saying, a few more percentage points better, even a higher chance of your outcome being a positive outcome by adding these additional therapies.
Most
So
of what we focus on, though, is especially after the procedure, is the rehab process. So we do sort of a protocol that we utilize after the procedure. So that's a critical piece of it, but it does take time for the actual cells that we implant to do their chemical signaling process and to do the actual natural process our body heals. So it takes a while, and sometimes I think folks are very anxious for things to happen quickly, but it does take a few weeks before we even notice any improvement. During those weeks, we have some strategies. Mainly, first few weeks, we talk about just range of motion, keeping the area that we injected mobile, not necessarily stressing the area. Generalized activity is fine, but going and working out your shoulder after you had it injected for the first few weeks is probably not the best idea. We usually want to see you back and make sure the injection was tolerable at about the month mark. And then we start talking at that point, how do we start increasing our activity to tolerance following this regimen that we've developed over years. And sometimes we recommend physical therapy, but a lot of times we don't necessarily recommend physical therapy because most folks have had several treatments of physical therapy before we've gotten to the point in which we're injecting stem cells or other orthobiologics. So usually we can just review what you've learned, make sure we focus the treatment to the area that we've treated and sort of the timeline in which we want you to move along that pathway.
Yeah, so primarily like initially after the procedure, the most important thing is just pain management, right? So initially because of the procedure, you get that big rush of inflammation to the area. So it feels stiff, at least it feels very sore. So, and then you can't take any anti-inflammatories. So typically we have patients just use your very common ice or heat type of protocol. We use ice initially the day of the procedure, and then after that we have patients use heat. We have them do gentle range of motion just to kind of mobilize the area. You can take acetaminophen for pain and some other medications if you need to, which you can discuss in the office. But that's pretty much it. You just kind of want to let the inflammation kind of do its thing. And then afterwards, like Dr. Farhat said, we put you on some restrictions with the main goal of just kind of getting that range of motion going. Until about maybe, depending on the site that we're treating, we probably put you on restrictions for about 3 to 4 weeks, depending on, again, severity of the site that we're treating. At that 4-week mark, after you have your restrictions, then this is when we start the rehab process. The whole goal is to try and regain some of the conditioning that you have. I'll get the mechanics back together how it was from before, whether it's with physical therapy, if you're already familiar with that, or with your own exercise program.
I think we've covered our topics that we wanted to make sure we got home today. So we do have some questions that have come in, and I think we have time to take care of those. So the first one, how long typically is the wait after you've had a steroid shot?
So I tell my patients to wait at least 4 weeks after a steroid injection because you want to make sure that anti-inflammatory effect is completely out of the system, whether it's an oral or an injectable steroid. Usually at about 4 weeks, you're pretty much in the clear at that point.
Yep. No, I think it's a very safe timeline. Same question, I guess. How long after a PRP or a stem cell would you be considered doing a steroid shot?
So usually for like any anti-inflammatory, NSAIDs would be around 6 weeks post-injection. So that'd be enough time that you make sure that you're clear off that inflammatory phase, and then whatever anti-inflammatory effect that's going to affect the procedure should have passed at that point. So 6 weeks after the procedure is what I usually tell my patients.
So the thing about the steroids is, in the oral anti-inflammatories, it's not just treating one area; it's a systemic response, and so your body has a full anti-inflammatory response. So, as long as possible, I think 6 weeks is extremely safe. So that's usually my recommendation. As long as possible, if there's some critical piece of your body that needs to be healed with anti-inflammatories, then maybe we can discuss it. But as long as possible.
Well, the hope is also at 6 weeks that your whatever issue you came with that you take the anti-inflammatory for is better, so you don't really need to take it anymore, and which is what we see most of the case.
But it's usually some other issue, right? It's
right.
Like some other body area, or sometimes people get ill and they actually need an oral steroid for some other reason. So
Here's a good question. When can you do a second or another regenerative procedure if you're already treated one side? When do you guys usually wait?
Yeah, so same site or different site? So different
site.
Yeah. So I'm going to wait if it's a PRP, it's much quicker.
Yeah,
a couple weeks to a month.
Right.
If we're just worried about blood draw and taking out too much blood, causing too much inflammation by injecting too soon. So you want to recover from the first one. You want to make sure your blood's had enough time to regenerate and repopulate, which happens very, very quickly. In a bone marrow aspiration, that's a different story. It's a little bit longer. I'm going to tell people wait at least 3 months.
Yeah, that's usually because we need the body time to replenish the area we're obtaining your stem cells from. And so trying to retap the same area within that short time frame may not give us the best outcome, is the concern.
Same. Yeah.
We had another question come in about hyperbaric oxygen and should I have hyperbaric oxygen beforehand if I'm doing a stem cell therapy?
I think it's again, it's one of these things that's just going to help. I don't think we've seen a really straight correlation between the two, but kind of looking at how hyperbaric works and how it affects your health, it should be helpful before your procedure, during your procedure, and even afterwards.
Yeah, theoretically, it makes sense. Physiologically, it makes sense.
Yeah.
But it's not something we've done, or I've certainly had enough patients do, to give you a scientific, makes a huge difference. Question about the recovery for the things we mentioned. Is it for stem cells only, or does it apply for PRP as well?
It applies for both. I mean, your body's inflammatory response and healing response is going to be very similar with PRP and the stem cells. The only difference is what you're using to induce that healing response. Stem cells do have that edge of having a stronger effect with healing and recovery. So I would say roughly they're about the same. I would say the big difference would be the area that we're treating. So let's say a peripheral joint, like a shoulder or a knee, it'll be sore for about 3 days, give or take. If we're talking about a cervical spine or a lumbar spine, that's probably going to give you about a whole week of pain and discomfort afterwards. So bigger area, larger area to deal with, more central to your movements. That's how I would usually counsel patients.
I agree.
We got a question about quadriplegia and if that's something we would ever consider treating. Is quadriplegics with stem cells and hyperbaric oxygen and other regenerative therapies. I can take that one. It is not something at this time that we feel we have sufficient data or sufficient quantity of cells to offer those treatments here. We are aware of some studies that are coming out that are very promising using culture expanded cells, using cells that are taken beyond the minimal manipulation guidelines that the FDA has us restricted with right now. So it is something I would encourage you to seek out, and the research centers that are doing FDA-approved clinical research. There are clinicaltrials.org is a great website that keeps track of those clinical trials. But I would definitely keep you encouraged that the science is moving that direction. But it's not something that we offer here at Michigan Center of Regenerative Medicine at this time.
Yeah. If it does at some point when it's going to be approved and FDA allowed to be done, then we're following it very closely.
Yeah.
So.
Yep. I think we may be reaching the end of our questions here. Had a patient who had a stem cell in November and had a setback pain for a week. I didn't do my PT, so I'm scared I'm going to get my pain back. Please call us. We'd be happy to walk you through that rehab program and what we can do for you. It's never too late to do something. So don't be scared that you've missed your window or you can't benefit. By all means, please call our office. Let us set up even just a phone call. Walk you through what those options might look like for you at this time. Last question, do we expect to be using more fat stem cells in the future?
Yeah, so it's definitely an option that we are looking at more. We've always offered fat as a stem cell option. It just so happens that when we discuss these with our patients on the different sources of stem cells, autologous stem cells, whether it's from bone marrow or fat, based on the wealth of data that we have with bone marrow stem cells, most patients will go that route. But so fat cells definitely has their benefits. So we do offer both. So if that's something that you'd like to consider, we can discuss it on a case-by-case basis.
I think also lipoaspirate has a smaller window of use, so it sort of has to stick with a peripheral joint. I don't know if we would use it in the spine, but
right.
Mainly knee, hip, shoulder, but probably not in the spine at this stage. But yeah, it's an option.
Yeah. Great. I really appreciate everyone who tuned in tonight. Hopefully you found some useful information, and anything you'd like to hear more, please give us a call. We'd be happy to discuss this, either telemedicine or in-person visits. And thanks again for tuning in.
Good night.
Night, everyone.
Bye.